metaphysical contamination.
Metaphysical contamination.
Something we come across a lot in treatment. What is that?
It is a subset of OCD where often a patient has had some type of a traumatic event.
Okay.
It may be abuse of some sort. It can even be some type of trauma involving some catastrophic event that occurred. And what's interesting is that the brain says that objects can become imbued with the association of this history. My first case many years ago was a woman who had been abused as a child, and anything associated with her stepfather, she felt had a sort of an essence to it. It was almost like, kind of like you'd consider radioactivity.
Right.
Whereas anything that had any association like mail or objects that in any way could have been in the house that she grew up with or connected to him, she saw as being contaminated by his essence.
Okay.
And in this regard, there was no issue of like health concerns. It was the idea of being, imbued with or absorbing this negative energy and this negative historical association.
Gotcha.
And so, in a way, the contamination might work exactly like contamination OCD, but often there is a need to combine work with trauma therapy in addition to the more traditional ERP work that we would do.
Gotcha.
Often patients have been exposed to some type of trauma, and we work, on a parallel system of working with the trauma and doing very specialized cognitive therapy for trauma, in addition to working with the ERP, that's the traditional exposure work.
So there will be both ERP and the trauma work as well for the history. And when you look at what the metaphysical contamination is, it's a lot like basically a reminder, and anything that becomes a reminder or a reminder of the reminder, which ends up working a little bit like radioactivity. You touch it, if it was there, it's a reminder now. And so the exposures then become being exposed to these reminders of the trauma or the place. Does that make sense?
Exactly, yes.
All right, cool. Got it right.